The realities of RA and chronic inflammation can physically affect everyone differently. Many times after an RA diagnosis, women are left with so many questions. To address some of these unanswered questions, I'm here with leading rheumatologist Dr. Vibeke Strand and medical advisor Dr. Pamela Peeke. Thank you for joining us. Dr. Strand, let's start with you. Can you please tell us what rheumatoid arthritis is?
Yes, it's an autoimmune disease. It's a systemic disease, but it primarily affects the joints. It starts in the small joints of the hands and the feet and usually progresses to most of the larger joints. It's symmetrical. And if it's not well controlled, it can also affect the internal organs such as the heart or the lungs. We don't really understand why it occurs. We know there's some family history associated with it, and we know that there are environmental triggers such as smoking.
What are some of the signs and symptoms?
But essentially it's inflammation of the joints. That means they may look red, they're definitely tender and painful, they may well be swollen. Because RA is a systemic disease, people may feel tired, even flu-like, even have fevers when the disease is actually not well controlled.
Dr. Strand, what causes rheumatoid arthritis?
We wish we knew. And although we have some ideas of some things that may predispose you to rheumatoid arthritis, we don't know the true causes. And what we don't know is why the disease continues. Why is it persistent? And what we're also learning is that basically you start to develop systemic inflammation before you even have joint symptoms. And so we now can target the fact that people will have the signs and symptoms of arthritis after they've already developed some of the antibodies that we know characterize rheumatoid arthritis.
Who's affected by RA?
Well, I think it's about 1.3 million Americans. It's about 3 women to every 1 man, so it is a woman's disease, at least to some extent. It occurs in the childbearing ages, most typically between 30 and 50, but there's plenty of women who develop it younger and also older.
How is rheumatoid arthritis diagnosed?
It's a clinical diagnosis, and frankly, I think it really requires a rheumatologist. I think it's very important. If you have chronic pain in your joints for even more than 6 weeks, that you be evaluated by a rheumatologist for the possibility. But there are other autoimmune diseases that can cause this type of arthritis, and so you need a clinical evaluation, physical exam, laboratory tests, essentially the pattern of the joint disease, and whether also there's damage to the joints by x-rays or other imaging techniques will help to establish what is actually going on.
As part of an overall treatment plan, what are the goals of medical treatment and what are the types of medication available?
So first of all, treatment of rheumatoid arthritis should be a joint effort between the patient and their rheumatologist. And treatment is not just medications. Obviously, there's lots of other things that go into the whole management paradigm. Exercise, alternating exercise with rest. Medications, though, are a cornerstone, and the cornerstone are disease-modifying anti-rheumatic drugs, or DMARDs. And in the last 12 years, we've had 10 new therapies, DMARDs, approved for rheumatoid arthritis, which has truly revolutionized this field. And these DMARDs are both synthetic agents as well as biologic agents, and many times they're used in combination. So that is the cornerstone because they've been shown as disease-modifying drugs to, in fact, inhibit the progression of radiographic damage or the progression of structural damage, and thus prevent deformities and prevent loss of function. In addition to DMARDs, many times low-dose corticosteroids are used. And to control pain, we rely on analgesics and nonsteroidal anti-inflammatory drugs. But it's very important with all of this to actually put together a treatment goal between the patient and the rheumatologist and to assess therapy on a very regular basis.
Dr. Peeke, along with medication, what else do women need to do to manage RA as part of their overall treatment plan?
You know, I like to keep things simple, Beth. And so I say the 2 E's and 2 S's. That's exercise, eating, sleep, stress. So when you start with the exercise, I always emphasize that it's not just the deliberate time that you're going to put aside to do your core work and to do your balance, flexibility, strength, and endurance. But it's also increasing the activities of daily living, and at the same time, to your point, protecting your joints, which is why before you even sit down and look at an exercise program, you're teaming with your rheumatologist. So it's important to really understand that you're a unique individual. You need that creative approach. It's natural, wonderful whole foods. Go to get that produce, the vegetables, the fruits, the whole grains, the lean proteins. These are so important to help support a healthy lifestyle. Next thing is sleep. 7 to 8 hours. That's my RX right now. And the final one is that stress issue. So you want to try to find really easy, simple ways to cope with stress and manage stress in a way that supports the entire holistic program we're talking about here. And also learning how to be able to adapt and adjust to life's everyday changes and challenges.
Taking care of you.
You got that.
Next, we will continue our conversation with Dr. Strand and also speak with medical expert Dr. Pamela Peeke about the physical realities of living with RA and chronic inflammation. Please join us, and remember to check out healthywomen.org for helpful tools and materials. And you can find more tips on how to customize your exercise routine on reachbeyondra.com.